Now, we're actually trying to look at another classification of neonatal jaundice. That's bilirubin, high levels of bilirubin in children. And this classification is based on when did it start. I don't know if you understand me. It's based on when it actually started. So you can actually start early, you can start late. So we just want to look at the times in which you can say, okay, this time is early, and the times in which you can say, okay, this time is late. So for the early and late onset neonatal jaundice, we said that you could actually be classified based on timing. So when you say it is early, it started between the first 24 hours. So they gave birth to the baby within the first day. You are having yellowing of the skin, yellowing of the eyes. That's when you say the jaundice is quick. Then late onset, that's when you say you gave birth to the baby, but it's like way after the first week. Okay, so anything within the first day, first week, you say is early, right? So let's discuss them. Right. So early, when you say early, it's typically less than 24 hours after birth. Okay, appears within the first day of life, is often considered an emergency. Okay, it's not something to overlook. So it could be due to hemolytic disease of newborn. It could be due to the glucose 6-phosphate deficiency, glucagon, right? This is glucagon or something. All right. Then birth trauma, could be infections, could be hereditary spherocytosis or elliptocytosis. So for all these conditions we mentioned, is something crazy. So it's usually what's an issue when you see a child with jaundice within the first day. So there's rapid rise in bilirubin. That's why you can see within the first day there's increased risks of what the bilirubin crossing the blood-brain barrier to cause kernicterus, where you have a lot of neurological issues. So it requires evaluation and treatment. Then late onset neonatal jaundice. This one, after the 7 days of life, is persistent or appears after the first week. Can be physiological or can be normal. Okay, the baby is actually trying to adapt to what life outside, or it can be caused by disease. So sometimes it's because of the breast milk, substances in breast milk, prolonged unconjugated hyperbilirubinemia, okay, hypothyroidism, biliary atresia, neonatal hepatitis. Then sometimes it's urinary tract infections. So clinical concerns is breast milk jaundice is usually harmless and self-limiting. Okay, conjugated jaundice requires urgent workup for liver or biliary disease. So may actually need some liver function tests, ultrasound, or metabolic screenings. Okay, so this is just a classification of neonatal jaundice, and this is based on like when it actually started.